Presentation will be on fatty liver disease. To begin, we will have Olivia explain to you exactly what fatty liver is. I will then go on to explain the anatomy of the liver and how it's affected by the disease. We will go to Riley to understand some of the causes and possible risk factors. Olivia will show up again so we can understand how this disease progresses and some of the symptoms as it progresses. Ava will show us how it is diagnosed. We'll hop back over to Riley once Ava is finished to see how this disease can be managed and treated. We'll see Olivia one more time so she can show us a 3D model, and to finish, Ava will close us out. So without further ado, please enjoy our presentation.
Fatty liver disease. What is it? It's a disease where fat builds up around the liver. This kind of forms into two different types. So MASLD, metabolic dysfunction associated liver disease. This one is the non-alcoholic version. And ALD, alcoholic related liver disease. In the past, they've had different disorders, like different names, like metabolic dysfunction disorder used to be called non-alcoholic liver disorder, etc., etc. Some people refer to ALD as ALFD. Another thing that is a fact with this is like NASH and MASH, which is like a second stage to fatty liver disorder, which we'll talk about in the future. I didn't realize that was the same disease. So when I was diagnosed with fatty liver disease, I didn't realize it came from my side of the family because my nana was diagnosed with NASH.
To properly introduce myself, I'm Ella, and I'll be talking about the anatomy of the liver and how it is affected. The liver is composed of two lobes that are made of 8 segments each, and those segments are made up of 1,000 lobules. These lobules all connect to the common hepatic duct, which transports bile that is used in the liver to transport waste. The liver, combined with other organs, is very important for waste management in our bodies. The waste begins in the intestines when they absorb nutrients and waste into our bloodstream. The blood is then received by the liver where the waste is filtered out of our body. Fat-soluble waste is carried away by and turned into bile, which is then excreted as feces, after more processing, of course. Water-soluble waste is sent to the kidneys for more filtering to then be excreted as urine. The liver does a lot more than just waste management, though, and actually performs over 500 functions. It has very heavy storage uses and holds about 13% of the body's blood, along with vitamins and other substances such as glycogen and iron. As we already know, it helps in the production of bile as well as regulation in many aspects. The liver is also responsible for the filtering of dangerous substances such as toxins, alcohol, drugs, and certain medications. When fatty liver disease develops, liver cells are filled with fat droplets and become stressed and sometimes scarred. When liver cells are in distress, this affects essentially all of the 500 functions of the liver, which means that bile production is lowered, causing stomach issues, the filtering abilities are weaker, causing unhealthy blood and a limited ability to process harmful substances. Storage in the liver is decreased, so there are fewer needed nutrients on hand, and the liver cannot regenerate its cells as well. Possibly the biggest issue is the harm fatty liver does to our metabolism. It is rather common for people with fatty liver disease to develop something known as metabolic dysfunction-associated steatohepatitis, which can cause excessive fatigue, stomach pain, weakness, and many other symptoms, including obesity. And while there is not a perfectly direct path, there is a link between fatty liver and sleep apnea, heart issues, hypothyroidism, and other conditions associated with obesity.
I'm Riley Clayson, and I'm going to be explaining the causes and risk factors associated with fatty liver disease. So as we know, there's the two types. For metabolic dysfunction-associated steatotic liver disease, the main cause is a buildup of fat in the liver. This is linked to specific health conditions, diet, genetics, and the complications with the digestive system. So it could be due to a number of reasons. The risk factors are having a high BMI, a high body weight, specifically a high visceral fat content around the torso, and metabolic conditions like type 2 diabetes, high cholesterol, and high blood pressure can also help aid in this fat accumulation. So for alcoholic liver disease, the main causes are specifically long-term excessive alcohol consumption. So it overwhelms the liver's ability to produce toxins and leads to fat not being broken down properly, which leads to the accumulation and inflammation and damage to the liver. So the main risk factors are, of course, binge drinking and alcohol use disorder. So as of 2023, the National Institute of Health classifies consuming more than 5 drinks a day or 15 drinks a week for men heavy alcohol use, and consuming more than 4 drinks a day or 8 drinks per week for women heavy alcohol use there. So you can see by this lower standard for women there that females can typically develop liver disease faster at a younger age and shorter duration compared to men, just due to the different fat compositions between the sexes there. Risk factors also include genetic predispositions like health conditions, obesity, and psychological disorders. So addiction and self-medicating for other mental illnesses can be a factor there.
Now we're going to move on to symptoms and progression. So there's 4 stages of fatty liver disease. So we have steatosis. This is known as like the silent stage because there's no symptoms. And if there is, they're very not noticeable. There's no inflammation yet in this stage, so it's only the fat buildup around the liver. So this is reversible. Our next stage is steatohepatitis. This stage, we're now introducing inflammation to the liver. So there's the fat buildup plus inflammation. There's hepatitis. There's some of the other symptoms is fatigue, weakness, upper right abdominal pain, loss of appetite, nausea. This stage is also reversible. Also the stage, some people refer to NASH or MASH. There's also like a newer term. Third stage is fibrosis. So this now we have long-lasting inflammation that's causing damage to the liver. Fat buildup, more fat buildup. There's more scar tissue than healthy tissue around the liver. Some of the symptoms is persistent fatigue, abdominal discomfort, weakness, mental confusion. In some cases, more alcoholic related. There will be jaundice. This stage, even though there's like, it's scary, some of the liver damage, it's still reversible. Now we're at the end stage, stage 4, this is cryosis. Some of the complications is internal bleeding, infections, liver cancer in some cases. Some of the symptoms is severe fatigue, swelling, easy bruising, bleeding, confusion, loss of appetite. This stage is non-reversible. You would have to be on dialysis, you would have to be transplant or liver disease, a transplant for a new liver. So this is a non-reversible stage.
Hi, my name is Ava, and I will be discussing how to diagnose fatty liver disease. So oftentimes, metabolic fatty liver disease is difficult to detect because it usually has no symptoms. It's commonly discovered during routine blood tests where elevated liver enzymes may be the first clue. To diagnose fatty liver disease and rule out other conditions, doctors use a variety of blood tests that include liver function tests, complete blood count, iron studies, and screening for hepatitis B and C. They also check blood sugar levels, A1C, and lipid profiles to assess metabolic health. Imaging and tests are also very important. An abdominal ultrasound is typically the first step, while an MRI or CT scan can provide more detailed information. Newer techniques like elastography measures liver stiffness, which helps detect scarring. In some cases, if results are unclear or more severe disease like MASH is suspected, a liver biopsy may be performed. This involves taking a small tissue sample from the liver to check for inflammation and scarring, but it is only used when necessary because of how invasive it is.
So, the treatment and management of fatty liver disease. For the metabolic type of fatty liver disease, weight loss is the main course of action. It helps to reduce the fat in the liver, which reduces the inflammation and can even start to heal the scarring in the liver. This makes it the most effective course of action. So this can be achieved through dietary changes mostly. So like eating food with low fat contents, low calories, being in a deficit there, while maintaining proper nutrition is very important. As well with exercise, of course. So losing 3 to 5% of body weight will help reduce the fat in the liver, and then up to 7 to 10% helps reduce the inflammation and the scarring and like more of the MASH stages of the disease. So it's also important that you lose weight gradually while maintaining proper nutrition, or it will make the disease worse. With alcoholic fatty liver disease, early stages can be reversed with abstinence to alcohol from months to even years, and then sometimes you can go back to the standards with drinking, although I wouldn't personally recommend it. So the complications with abstinence is that you have a withdrawal period, 3 to 7 days since the last drink, which has symptoms like sweating, shaking, even hallucinations. It can be deadly for some people. So some cases require gradual and planned alcohol reduction to avoid these complications. So medications like acamprosate, disulfiram, naltrexone, and benzodiazepine are used with withdrawal and alcohol use disorder to help reduce those cravings. And ongoing treatment is needed to prevent relapsing, like therapy, psychology visits, and group sessions like Alcohol Anonymous, where you take steps towards amends with those around you, are very helpful with treatment and management there. Thank you.
Okay, so now we have our 3D model that shows 5 stages of the liver. Of course, the first one's going to be the healthy liver. You can see it's pink, it's nice. Second stage is steatosis. Third stage is steatohepatitis. Fourth stage is fibrosis. And the last stage, the end stage, is cirrhosis, which you can see the scarring and the fat build up on it. There's a little image that's like cut out on the side. That is just like showing like liver cancer. So if you were curious what that one was, it's just not a part of the stages that we wanted to show.
Alrighty, so to conclude our presentation, I'm just going to review everything that we talked about. Fatty liver disease occurs when excess fat builds up in the liver. This includes non-alcoholic related and alcoholic related. It is often silent in early stages, but can progress to inflammation, scarring, and irreversible cirrhosis. It is strongly linked to lifestyle factors like diet, obesity, alcohol use, and other health conditions. Early detection is key. Routine blood tests and imaging help to prevent progression, and it is manageable and often reversible with a healthy diet and regular exercise, gradual weight loss, reducing or eliminating alcohol. Overall, you can protect your liver health through lifestyle choices and can prevent serious complications and improve overall health. Thank you so much for watching our presentation.